for you today. And I hope people are doing well. I want to give you a little advertisement about something we're going to do in 2 weeks. It became really clear when we had the SHRM annual conference last week in Louisville. I guess that was the week before last now. That there's a lot of people are suffering from mental stress just because of this COVID-19 and all the crazy stuff around it. So we've got some great speakers that are going to join us on the 27th of September, 2 weeks from now, to talk about what they're doing in their organizations to help relieve some of that stress and help people feel better about their lives and their work. So I'm looking forward to that. Let's go ahead and get started right now because, man, there's a whole bunch more activity. So we're going to start out talking about what's going on in Frankfort, and then we're going to hit beyond, and that beyond is, Washington, D.C. We got a host of our team that's going to help out with this, but the first speaker is going to be Senator Morgan McGarvey out of Louisville, and he's been a senator since the early teens, I think, 2012 maybe, Morgan?
That's correct.
And he's a graduate of the University of Louisville, University of Kentucky Law School. He worked for Frost Brown Todd in Louisville. He's also served as an assistant attorney general in Frankfort. He's very active in all the stuff that's going on in Frankfort. And we asked these guys to give us an update, and we're trying to avoid politics on these calls, Morgan and Whitney. But I'm sure you've got different perspectives on things. So, share with us kind of what's going on. Let me go ahead and introduce Whitney too, because he's going to speak next. Whitney Westerfield is on here, lifelong resident of Western Kentucky, down in Christian County. Christian, Logan, and Todd counties are the counties he represents. He's also been in the Senate since 2012. A great record of leadership in the Senate, and we're just glad to have both of you guys here. So, Senator McGarvey, why don't you start out and just give us kind of an update on what all's happening there, and save some for Whitney to share too.
Absolutely. I appreciate you guys having me. I apologize if there are any connection problems. I'm actually in a hallway right now with no internet, not in Kentucky. So just wanted to call in quickly and hope you guys can hear me. It's interesting. You said don't get into politics. I'll try my best not to, although obviously a lot of what we do in Frankfort is political. The pandemic shouldn't be. And the pandemic is one of those things that we are looking to get together and handle correctly. And so when I look at this session, there were 5 bills introduced. 3 of the 5 bills had nearly unanimous consent in passing. And we all sort of agreed that these are things we needed to do, like spend a little bit more of the American Rescue Plan Act dollars to help, again, recovery from COVID. We helped the governor with an economic development project. And then, of course, there's the 2 bills where we had some disagreement, Senate Bills 1 and 2. Now, even in those bills, I'd say, and I don't know, Whitney, what you think, probably 90 to 95% of what was set forth in those bills was also agreed to by both parties. The big sticking point became masks. And, how I view this is the New York Times released information today that 6 of the top 10 counties in the entire country for COVID are in Kentucky. And the Delta variant is surging here. This is no longer an urban problem. This is something that's impacting our entire state. And so I thought, just the way the legislature is organized, we can only come in on our own between January and April of any given year. That makes the legislature very powerful when we're in session. It makes the executive branch very powerful when we are not. And I think this is the type of crisis and emergency where the executive branch should have all of the tools at its disposal to deal with it. And so I thought it was not responsible of us in the legislature to roll back the Kentucky Department of Education's regulation on masks and push that off to the locals. Look, we've handcuffed the governor with what we did last year. And, we didn't take any affirmative action. We just left some things to the local. And so while I think that local control is important and local should have a say in what goes on, I also think that the state should have the ability, if necessary, to deploy all of our resources to keep people safe. And I think those were kind of the sticking points in what happened this session. And of course, that's what got the most attention. But really, it was mostly a session of agreement between the legislature, Democrats and Republicans in the legislature, and between the executive and the legislature, except for those 2 parts of those 2 bills.
All right. Whoops. Is that somebody that's really asking a question, or what is that? I think somebody needs to mute, but anyway, okay, Morgan, way to go. Get this started. I appreciate it. Yeah, I know that to say don't be political is kind of impossible when you're representing a group, and but we managed to do it pretty well. This is our 44th call like this. So Whitney, you want to add some things now and kind of give your perspective?
Yeah, and that background noise, by the way, is the courtroom that I'm in at the same time, waiting. I'm listening for my case to be called. So if I have to just quit talking, I apologize.
Okay. Then that's okay. That's good to know what it was.
Yeah, I'm sorry. It was Judge Delahanty from Jefferson County calling her docket one case at a time. Yeah, I think Morgan summed it up pretty well there. There was broad agreement on most of what we did, including the economic development initiative, the package that the governor and the leadership and the two chambers had worked on, and that was easily passed. The other two really were Senate Bills 1 and 2. Senate Bill 1 dealt with education. Senate Bill 2 dealt with the healthcare space, both related to COVID. And I'd say that Morgan is still right, saying that it was really the masking was the key differentiator between the caucuses on those bills. Obviously, Senate Bill 1 really boils down to whether or not the decision about requiring masks is done at the local level or at the state level. Morgan's not wrong about the importance of the executive having authority to act when the legislature's not in session. The problem, though, and this is where you see some disagreement between the parties, at least up to a point. The problem that some on the right would say is that those emergency powers that existed by statute, Chapter 39A, which were written in the late 90s, have been untested. I mean, this is not the kind of situation that was imagined when that statutory framework was created. And we've been under a state of emergency for 18 months. And there are some instances where the use of emergency power has been unbalanced or inequitable, or its application has been uneven in some regards. And the courts have ruled accordingly on that when those challenges have come up. And so it built this desire to make a change to limit. Back in the regular session, we fought all those fights. Some people wanted to limit it more than we did. I'm not one of those folks. Some people wanted to be a little bit more lenient than what we did. But we found a middle course and put some reasonable limitations on those emergency powers. All of that was tied up in litigation until about 3 or 4 weeks ago, when the Kentucky Supreme Court issued a unanimous opinion. There was a concurring opinion that agreed with the result, but they wanted to speak both by the Chief Justice and Justice Hughes. But they still concurred in the result. So 7-0 essentially agreed that the legislature has the power that it set forth in those bills back in January, though there's still litigation on that front. But that forced the governor's emergency declaration and all the orders that followed from that to be reset and couldn't be extended unless we were called up. And that's what we did. The masking was a big part of that debate. And the conversation circled around whether or not the statewide decision making is better or local. And I thought Morgan did a fine job on the floor highlighting some interesting arguments about the bills. One he did mention just now that I think is interesting, and just on Senate Bill 2, and I'll get to that in a second. But I'll tell you, I'll use this illustration from a few weeks ago, before the Supreme Court ruled, before the emergency order was, or the executive actions were taken, and the Board of Education's masking requirement was effectively struck down by the court, or allowed the legislature to act to shut it down. There was a teacher from McLean County, it's out here in my end of the state, and she testified in front of the Administrative Reg Review Committee, and she said, look, the McLean County figures, and she was talking about positivity or infection or something, but she said, our numbers are X, Jefferson County numbers are Y. The response for Jefferson County doesn't have to be the same as it is in McLean County. And she's right. And so the argument was to allow those local districts to make decisions on their own based on what they're seeing in their own area. And I think we've seen a really strong result I haven't heard our Morgan, you may have new numbers, but I talked with Eric Kennedy over the weekend. At that time, there were 30 plus districts who had already decided to keep a masking requirement in place. I expect that number is going to go up substantially. But an interesting thing, a lot of these school districts are choosing a fixed endpoint for that requirement, or they're going to say, well, we're going to require masking for another 2 weeks or for another month, and then we're going to revisit it again. They didn't have that power. They were just beholden to what the state, the governor and the Department of Public Health were ordering. So I think this is a good outcome. And I think the districts, which we trust to make decisions every day on how they operate schools, will end up being the best decisions. And the other one is Senate Bill 2, the thing on healthcare facilities. The only disappointment I have there, Morgan, you can chime in if you want. My only disappointment is that we couldn't get the governor to expand his call. The executive proclamation that called us into session capped what kind of money we could appropriate. There was a strong contingent, at least in the Senate GOP. We wanted to spend. I think the Democrats would have agreed. I think we wanted to spend a lot more money on our healthcare professionals to help recruit and retain staff. I'm in Hopkinsville, or just north of Hoptown. We've got Jenny Stewart Health, and Nashville hospitals are offering 2, 3, and 4 times the hourly wage that we're able to pay for nursing staff to recruit them to come to Nashville. And we're losing those folks. And I don't know how we're gonna get those folks back. So I wish we could have been able to do more. But that's the gist of what we did. The other bills, there was a joint resolution which actually extended the executive emergency orders in a number of places where I think there's broad consensus until January. That one is one of those that Morgan mentioned was passed nearly unanimously, if not unanimously. But I think it was an effective session. I would like for us to have had more time to dig into some amendments to some of these bills. I suspect Morgan feels the same way, but otherwise it was not bad.
All right. Good stuff. You know what? We were going to do a poll. We do polls on here often, and I jumped to kind of catch up on some things, and I forgot to do the poll. So you guys, I know if you have to go, just nod goodbye. But this poll, just take that's it. Morgan flew into Washington, D.C. for a special celebration for a relative of his, and has got a plane that you're going to fly home on. So that's why you're standing in a hallway, right?
It is. Yeah,
Okay.
my brother, very proud of him, got promoted to lieutenant colonel this morning. And so got to be up here with him for that.
That's awesome. Now, do you have any final words you want to say? Then we'll share this. I'll send you the poll. It's kind of fun. I'm going to find out how many of these people want to do masks. Oops.
There we go. Yeah, I'd love to know. So good. Thank you guys for letting me join.
You bet. We'll see you later. Thanks for joining us,
All
Morgan.
right.
Whitney, you've got court. You're in court. So do you need to step out and go do that?
Yeah, unless you all want to hear the eviction docket continue in the background, I'll spare you that.
Now that I know
I don't have to tell you all, but please go get vaccinated. Encourage your folks to get vaccinated, especially if they're not vaccinated. I think masking is probably the right call, the CDC, especially if it's an N95 mask.
Yep.
You had a number of folks encourage that from the Senate floor, and I suspect the House floor. You had other folks on both floors say other things that were not helpful. But my message is to encourage vaccinations. So please encourage all your folks to do that if you haven't already. Thank you all.
You bet. You take care. Thank you very much. All right, we've got a poll. How about this? And then I'm going to introduce Tyler and let him jump in. Does everybody can see it? Does your organization currently require employees to wear masks in any capacity? So when they come into the office or whatever, let's get your answer there. And then number 2, does your organization currently require masks for your customers and or visitors? And you'll understand how important this is in a minute when Tyler speaks, but if you do, give us a yes. If you don't, that's okay. Does your organization currently require vaccinations? Are you vaccinated? We appreciate you sharing that, just because you know what, we've gone steadily up. We started in the 70s, then we were in the 80s, and I think the last time we did a call, we were at 92%, which is pretty darn good. And when you get that done, let's submit it to us and we'll see what kind of results we get. And we've gotten a comment or two. You want to go ahead and take those? Allison or somebody want to share those with us?
They're not questions, they're comments. So I would recommend people can read them if they're interested.
Yeah, I see. I hadn't really looked at them. Okay, well, we're loaded with opinions, so.
All right, 10 more seconds on the poll and I'm ending it.
Okay. All right, here's what we've got. Does your organization currently require employees to wear a mask in any capacity? 72% are saying yes. Okay, 26% no, and that's interesting. 1% still remote, and I wonder if some people may be going back to remote here. Things get much worse. Okay, does your organization currently require masks for your customers and or your visitors? Wow, 62% said yes, 35% said no. Okay. Tally, you're figuring out how you're going to weave this into your conversation, right? Does your organization currently require vaccination? And not very many, only 8%, mostly no, not requiring it. Are you vaccinated? 81%. I don't know where I got that 92. It seemed like we had more partials or something last time. I don't know. And I'm sorry if you're not comfortable answering. We sure understand that, and I apologize for that. But okay, 81%. That's still pretty darn good. If you have children in school, do you want them to wear masks? Yes, 41%. No, 13%. And not decided or something, 46. And maybe they don't have kids. It's kind of, we might have defined that a little better. But okay, gives you a little something to work with. Hey, we're delighted to have Tyler Morris back. Jim Morris sends his regards. He's out of state doing a couple of days worth of depositions, but he and Tyler worked this weekend to get this together, and Tyler's done a great job for us before. He's a graduate of UK Law School, and Tyler, we're just glad to have you here.
It's nice to be here.
And is Junior here with you? Is he going to be waddling in the background there?
No, I wish it'd be more fun if he was. So,
all right, take it away and tell us what you've pulled together for today.
Sure. A lot of changes coming, especially on the federal end with regard to your businesses. And I noticed that. Thank you, Lyle, for putting up that poll. 90% of the employers here do not require vaccinations. That is going to be changing. On the 9th last week, President Biden outlined a 6-step plan. Some of the steps not quite as important as others, but some of them are going to have substantial impacts on your businesses. Now, Lyle, we can go to that next slide.
Yeah,
there we
there
go.
you go.
If you recall, we talked back in March, April, May of last year, or of this year rather, about the emergency temporary standards that OSHA puts out. We are anticipating a new one. We were surprised it actually didn't come on Saturday. That was our expectation. Any day now, there should be a new ETS entered. Now, the first step of Biden's 6-step plan requested that OSHA issue the emergency temporary standard to mandate that all employers with more than 100 employees be required, not recommended, be required to have their employees vaccinated or submit to regular testing. Now, we're not sure what regular exactly is going to be, whether that be daily, weekly, we're not sure yet. Now, I do know that, for instance, I know Fayette County, for Kentucky, with their schools, they are looking into doing daily testing if you have been possibly exposed, rather than having to have your child be removed from school for the 10 days, having your child be tested every single day. We don't know if that's something that the federal government is looking at, whether it will be either be vaccinated or be tested daily, or be vaccinated or be tested monthly. All we know now is that it is regular testing. That same day, that first step, the president also stated that all federal workers, including federal contractors or anybody in close connection with a federal contracting job, is going to be required to be vaccinated. And they will not have the choice to have regular testing. The federal contractors and federal employees will have to be vaccinated. They will not get that option to do the regular testing instead. So big changes coming. That second step was just about the booster shots. Booster shots are becoming more common. It's starting to be allowed for more people because they're recommending at least 8 months from your first shot, or from your final shot. If you got Pfizer or Moderna, those 2 shots, then you can go ahead and sign up for a booster shot. And the FDA has not approved them. They have approved the Pfizer vaccine, but they have not approved the booster shot. It's still recommended to get. Personally, I know we don't like to get political, but I will be getting mine. So get your booster shot, get your vaccine if you're so entitled. The third step is going to focus on the K through 12 education. The federal government and President Biden have said that they will be paying the salary of any teacher or administrator who had their pay withheld by a state who opposed mask mandates. If that teacher was possibly exposed, had to leave the school system for a period of time, the federal government will make up that pay. The president is also recommending vaccination requirements for all teachers and staff, and is seeking governors to apply that, as well as requiring all Head Start, which is a federal program. All Head Start educators are also going to be required to be vaccinated. That fourth step, again, important. The president intends to use the Defense Production Act to make rapid tests more available and get more of them to be able to be the at-home tests. He's worked with Walmart, Kroger, some of those local, some of those big-scale retailers to get the at-home testing revamped. We haven't really heard a lot about at-home testing. Not many people are doing them. But that is going to change. We are going to be able to have the at-home tests. That should be happening sooner, although there will be a fee. Those will not be free like a lot of the rapid tests and your PCR tests have been. But that is, in my opinion, a step in the right direction, getting those available to more people and having those tests be readily accessible for anybody that needs them. Even if they may have a fee, I don't think it'll be anything drastic. This one, step 5, is going to be big for businesses. The Economic Injury Disaster Loan Program, the amount a small business is allowed to take has been quadrupled. Now, these loans are low interest, long-term loans. Instead of the $500,000 that were available to small businesses before, small businesses are now entitled to $2 million. So quite a big boost. It wasn't, we were expecting maybe a double. Instead, you are able to get 4 times the amount with that small business loan. How long that will last and how long the funds are there, that's to be seen. But that is a big help to small businesses, and we do anticipate that being used by the vast majority of small businesses that have already taken that $500,000. Step 6 is something that I think was really started by President Trump, and President Biden is going to take it even further, and I think it's a good thing. And that is to expand new medications, not necessarily experimental medications, but trying to find something that is going to not just prevent COVID in the vaccination sense, but is going to help cure it once you have taken in the virus. So that is going to be a big thing going forward, is not just preventing it, but once you have actually come down with COVID, being able to get you well, get you healthy. And to further that goal, the president has announced that the National Guard and the military are going to be deployed to overburdened hospitals. Anybody that's tried to go to a hospital recently, for instance, one of my siblings tried to go last week, or this week rather, didn't even get a room, has a torn bicep, and they couldn't even get him back in the hospital. They just said, go home, your injuries are not life-threatening. So right now, hospitals are really at a critical capacity. They are struggling. Emergency rooms are struggling. There are no beds. So sending in the military and military doctors will be a step in the right direction. Hopefully, we're able to see some of the burden really come off of the hospitals, and maybe they can get a little bit more staff. As you heard the senator say earlier today, they're losing nursing jobs to even other states. So maybe deploying the military, it's not going to fill that staffing role, but at least it'll temporarily kind of fill that void, and maybe we can start getting people healthier a little quicker. We can go ahead and go to that next slide, Lyle.
Got it.
As I stated earlier, actually, I don't think we've covered that. So we've talked before where the mask mandate on a national level was likely to be unconstitutional. Whether people think it's a good thing or a bad thing, that's not for me to decide, but it is likely not lawful, which is why we haven't seen the president actually try to go ahead and do that. It's not likely to be constitutional. However, those emergency temporary standards can be a great workaround for any limitations that the executive branch wishes to go ahead and push past. So OSHA issuing this emergency temporary standard, which they have not done yet. Like I said, I checked this morning, I haven't seen it entered, but we expected it to come anytime now, creates a loophole. And that loophole was essentially confirmed by the president's chief of staff, who earlier this week, as much as we all enjoy political Twitter, retweeted a post that said, OSHA doing this vaccine mandate as an ETS rule is the ultimate workaround for the federal government to require vaccinations. Knowing that the federal government is not going to be able to do that with a mask mandate and a vaccine mandate, they found another way to do it, and they're essentially admitting that. I don't like to get political, whether you want vaccinations or not. They found a way around it. Whether it's going to be legal or not, that's again something that will have to be litigated, but at least in the meantime, it is going to be allowed to stand. So like I said, the legality of the workaround, who knows, but for now it's going to impact your business. Now, with this ETS, that emergency temporary standard, the president is also, and this is huge. This is very, very big for any business and frankly, just any person that would go into a business, which is all of us. The president has requested that OSHA call COVID a known danger. As employers, OSHA requires you to protect your employees from known dangers. It's under the general duty clause. So you have to take all available precautions to protect your employees from these known dangers. If COVID is identified as a known danger in the ETS that is coming up, that we're waiting for any minute now, an ETS is immediately implemented. You are required to follow it right away, and you will be required to protect your employees from COVID in every way possible. That includes vaccines. That includes masks for your employees. And the one thing that nobody has thought about, and that is going to be huge, is you will have to protect your employees from your customers. Your customers will also have to wear masks, because you have to take every precaution known and every precaution available to protect your employees. And if you have people coming into your office, visitors, delivery personnel, customers, patrons, whatever you want to call it, doesn't matter if it's somebody coming to eat lunch with you. You have to take every known precaution if COVID is declared a known danger. And that includes requiring masks for the people that come in your door. So that's something that hasn't really been discussed. And as the president's chief of staff has stated, it's a loophole. It is a workaround. It is a mask mandate without a mask mandate. So if I'm looking at my numbers correctly, 62% of you required customers to wear masks. That's not even 2/3. The rest of you, if you're employers, you're going to need to start doing that. And I wouldn't wait. I don't think I'd wait for OSHA to go ahead and issue the order, the ETS, because if it comes out on a Tuesday, you don't see it till a Friday, then you are not in compliance for those 3 days. It is required immediately. When OSHA issues that ETS, you are expected to know and you are expected to follow. There's not any wiggle room there. So our recommendation, go ahead and have anybody that comes in your door wearing a mask, and you should be wearing a mask as well. Now, the president requiring vaccines for anybody with any employer with 100 or more employees. Let's see, 90% of your employers are not requiring vaccinations. I'd venture to guess that most of you have over 100 employees. That number is going to be 100% very soon. Instead of the 10% that are being required, 100% of you are going to be required, because not only if you don't have 100 employees, remember, we just talked about the workaround. It doesn't matter if you have 100 employees. You have to protect your employees from known dangers in every way possible, which would include vaccines. So while the president's step one there said 100 employees or more, you have to be vaccinated, OSHA's ETS is going to make that if you have 2 employees vaccinated. So just another thing to think about. Things are going to be changing in the coming weeks in ways that, frankly, we don't know. It's going to depend a lot on the wording of the temporary standard. Should that be coming? I mean, if it doesn't come, I'll be absolutely shocked, but that should be coming any day now. I know we have a lot of questions pouring in. I'll try to address that at the end if I can. It's too hard to keep up with. But that is the big thing right now. And along with, requiring the vaccinations, requiring the masks for both employees and employers and customers, you're going to need to continue to do the sanitization things that we've been doing for the last year and a half. Keep your workspace clean. And I know Lyle earlier, one of the questions had possible remote working again. That's going to end up becoming big, because if you have the ability to have your employers do that same job, perform those same functions at home, then that would be one of the precautions that you could take in protecting your employees from known dangers. If they can perform all job functions from their home or from a safe space, and you are not allowing them to do that, you could be running afoul of OSHA's ETS that will be coming out any day now. So that's another thing to think about. If you can have your employees, even though if you just brought them back in, things are starting to get back to normal, it may be time to go back on that, send them back into their homes, because it protects you, it protects them. You're not going to run afoul of OSHA if they're not there. It's something to think about, and I'm sure the second the ETS comes out, we'll be right back to scrambling to figure out how best to educate you all and figure out what we can do to move forward. If we look at the Kentucky numbers, Lyle, we can go to that next slide as well. I remember if we looked 2 months ago, this was all yellow and green. I mean, this was starting to look really nice. Look at it now. This is the 10th. This is 3 days ago. Every county's red with the exception of 2. Our numbers are skyrocketing. And with this ETS coming out, you have to protect your employees, even from your customers. Now, you could have employees that are completely vaccinated, that are wearing masks, that have filters and taking every precaution. But then you have a customer come in, a delivery person, a visitor come in from these red counties, which is everywhere, and they're not wearing a mask. Who knows if they're vaccinated? Who knows if they're infected and not presenting any symptoms? You have to protect your employee from that person, even if you do not know whether they are sick, whether they're vaccinated. You have to take every available precaution to protect your employees here. And that's going to be big. We just wanted to put this up so that you could see COVID isn't going away. As much as we thought it was 2 months ago, we were slowing down these webinars, moving to from weekly to 2 weeks to monthly. expect a reversion. This is going to be something that we talk about more and more, and hopefully the numbers will go down. But as of right now, the incidence rate is up. Almost every county is red, and Kentucky is struggling. So we can go ahead and move on to that next slide. So now we've talked about federal, we've talked about the scary stuff. Let's talk a little bit about Kentucky. The senators kind of touched on it a little bit earlier. I won't go into too much depth because they're going to be the experts here. But on the 9th, the governor gave a COVID-19 update, which established the cases are on the rise, and just talked a little bit about his plans to move forward. One of those plans I think we can all get behind is moving to have the National Guard sent out to the hospitals. I know they were in 4 hospitals now, a lot of them I think in Hazard over in Eastern Kentucky where it's really struggling. Now it's going from 4 hospitals to 25. He's sending 300 additional National Guard troops out to help these hospitals because like we talked about earlier, they are struggling. You cannot get a bed, you can't get a room unless it's an absolute dire death situation. So that should really hopefully take some of the lack of help, for a better term, and really remedy that and try to take a step in the right direction moving forward. Now you also heard one of the senators, I believe it was Senator Whitney, discuss the Supreme Court's rejection of the governor's moving for an injunction. So the governor moved to have the limitations that the legislature set forth be limited even further, kind of taking those off the board so that he would be able to act as he saw fit. The Supreme Court unanimously held, there was a concurring opinion, I believe it was Justice Hughes out of Louisville, that had a concurring opinion rather than just agreeing with Justice Van Meter's opinion. But it was unanimous, and they set forth that the governor is still allowed to issue his executive orders as long as they're not going to exceed a 30-day span. And then you're going to have to work with the legislator and get some approval there. So should a need arise, should there be an executive order that needs issued, it will be issued. It will be allowed to stand until the legislature is able to meet and determine whether it is really the best course of action for Kentucky. Like one of the senators said, they prefer right now the way things are voting, especially with schools, to let the local governments decide, because what Louisville needs is going to be different than what Lexington needs, is going to be different than what Hazard needs, or Paintsville or Pikeville. It's going to be different for everybody. While there is, in general, people should be wearing masks, people should be getting vaccines. If there's one case in a county compared to 300 or 400 cases a day in a county, they're going to have different needs. And that's what the legislature is trying to do moving forward. And I expect to see more of that as we continue in the coming months. Now, they did do a special legislative session, which ended, I think, 4 or 5 days ago. That Senate Bill 1 and 2, which you heard a bit about earlier, were pretty big. The Senate voted to disallow a statewide mask mandate for schools. That had been instituted by the governor. The governor then vetoed this bill, and the veto was overridden by the supermajority in the House and the Senate. So there are no longer allowed to be a statewide mask mandate for schools. That is going to be a locality-driven decision. I do expect many of the localities, especially looking at Lexington and Louisville, they are going to be continuing their mask mandates. You may see some of the smaller counties choose not to do so, but that, again, this is going to be a county-by-county decision, a locality-by-locality decision, where the school board, who makes the decisions every day, is going to be allowed to continue to do that and really be able to look at it week to week, month to month, and decide what is best for their schools. So the other big bill that was implemented is a general ban. The various spending bills. You heard that there was a lot of concurrences on both sides about the spending bills. They wish they could have spent more or less, of course, but that was approved. There is, I think, 3 spending bills that were approved. We don't need to necessarily go into a lot of detail about that. You can look at those yourself if you so choose. I think that's bills 3 through 5. You can look at those if you want, but that's where Kentucky is standing right now. So what it ends up being is Kentucky just banned we can go to that next slide. Kentucky just banned a mask mandate. OSHA is looking at the ETS. What competes? What do employers do? How do you decide which is going to prevail? While the president's efforts are still going to be nitpicked as to legality, as to whether they are allowed to move forward, it's looking like the president has found a valid loophole and he will be within his authority. So what that means is the governor's authority has been reduced. The Supreme Court has just held that. The legislature has voted to go ahead and ban mask mandates, but OSHA is going to say to employers, you need to have everybody wear masks. Employers are going to be required to do that. Employers are going to be required, like we talked about earlier, to take every precaution available, regardless of what the state government has said. That is just, the state government has said that, or I'm sorry, the legislature has said that the state cannot mandate it. It didn't say employers can't. They can't ban an employer from making their own decision. So the employers are still going to be required to take those steps, which means essentially that there will be a mask mandate, because employers are going to be requiring employees and customers, patrons, delivery people, whatever you want to call it, to wear masks as they come in the door. And we recommend you go ahead and start doing that now. Don't wait for the ETS to come out. It will be coming out any day now. I mean, the presidential executive orders came out on the 9th. We expected it to be done over the weekend so that maybe it wouldn't be in the news quite as much. It didn't. So any day now it should be coming. And we think you should go ahead and prepare for that inevitability. So if we look down here at those bottom two sub bullets, this may require Kentucky employers with more than 100 employees to mandate the vaccinations, to mandate the masks, as well as protecting them against their against their customers, their visitors, so call it. The general duty clause may have a whiplash effect. Even if you have less than 100 employees, you're also going to have to consider those same precautions. Even if the president said, 100 or less, 99 or less, you're fine. It's looking like the ETS is kind of going to surpass that. The thing is, we don't know right now. It's going to depend on the wording of the temporary standard. We haven't seen that yet. We haven't seen a draft. But like I said earlier, when the ETS comes out, it is mandatory. There is no, it'll start in a week, it'll start in 30 minutes. It is the second that ETS is entered, employers are expected to follow it. And until we know more, we recommend you go ahead and do that. Maybe start trying to draft changes, policy changes for your business. Go ahead and inform your employees of what is coming so that they can be prepared. But it's looking like there are going to be substantial changes coming in the next few weeks, and you're going to want to tune back into our next webinar for an update.
Wow. Okay. You've got a lot of great questions out here.
Great.
Thank you, Tyler, for taking this on. And I know you had to deal with this all over the weekend a lot,
yeah.
and expecting the thing on Saturday and then it not coming out. I don't know if that's good or bad, but people are going to need some time. One thing people ought to recognize, Brad Patrick works here, and the guy has seen everything under the sun. He helped Delta get through 9/11, so you can imagine how that was. But he would say, okay, we have to do this immediately, but there's nobody out checking this stuff,
Right.
It's like they don't have people to check all this. So don't feel like, oh my gosh, I'm going to be in so much trouble if they put this in one night and I don't have it ready the next day. But
Right.
You got to be thinking about this and making plans to, I'm thinking right now, I'm going to put a box of masks right beside the entrance to our office so that anybody comes in, doesn't have one, knows they can get one. Just some simple things to make it easier. But
right.
Why don't we, Allison or Chase, are you in a?
Yeah, I've been keeping track of questions. So I'll throw these out, but I have a feeling that a lot of them, the answer is going to be that the guidance isn't there yet. So Will OSHA require employers to have vaccinated employees wear masks with these changes?
Yes. Of course, the ETS could say something I'm not expecting. But again, I mean, look at these breakthrough cases. You have seen people who are vaccinated that are still coming down with the virus. You have to take every precaution to protect your employees, including having those who are vaccinated wear masks. I'm vaccinated. When I go into court, still have to mask up, still have to take those precautions, and employers are going to have their employees and their customers take those same precautions.
Okay, do we know how the 100, how we determine if an employer has to adhere to the over 100 employees mandate? Is it per facility, total employees?
I would anticipate,
full-time?
I would anticipate it being 100 employees total. Of course, I don't have that information yet. This is all an educated guess. I would assume maybe it's by FEIN number. A general business, if you have 100 employees under one FEIN, I'd say that you'll be required. But again, that's up in the air. I can try to provide an update when that comes out.
Perfect. And do we anticipate the medical issues or religious exemptions will still apply for these mandates?
I would say yes, they may be a little bit more strict, especially for the medical exemptions, but the religious exemptions I would probably anticipate still being valid to an extent. But again, it's going to depend on what the ETS says.
Okay. If an employee does not want to get the vaccine and chooses regular testing, who's responsible for the cost of the test?
I would say probably the employee. Again, it's going to depend on what the ETS says. That'll probably be my answer to a lot of these, but I'll try to give an educated guess. But you also have to remember the ETS is going to, it may push past that 100 employee limit. And even if you have less than 100 employees, to best protect your other employees and your customers, as well as your yourself, you may have to require even less than 100 employees to get vaccinated. There may not be an option for the regular testing. It's all going to be seen here in a couple weeks, maybe this week. I'm surprised that hasn't come out yet. But right now, the answer has to be a simple, I don't know.
Fair enough. Okay, how do we think that will apply when we send employees into public spaces for work?
Public spaces as in, well, I mean, so public spaces are going to end up, especially if it's an indoor public space, they're going to end up having the same requirements because there's going to be an employee at some level in a public space, whether it's a janitor, somebody that unlocks the doors. At some level, there's going to be an employee, and the employer will have to protect that employee by having the customers wear masks. So whether it's something outside, that could be different. If you're talking about a public space being a park, something like that, that may not necessarily apply. But again, with the ETS stating you have to take every precaution because COVID will be classified as a known danger, it's probably still a good idea to have your employees wear masks at this point, regardless of the situation, unless you have them doing remote work from home.
Perfect. Okay. Do we see any extension on the funds that are paid to employees when they are out with, so the FFCRA, do we anticipate the FFCRA being extended in any way?
That I don't know. I can get with Jim and try to send out an answer later if we need to, but I'm not sure on that, to be honest.
Perfect. And then it looks like our last question, as soon as the ETS comes out, will we have a quick conference call? Another one of these sessions.
I would anticipate having another webinar within a couple of days. That's more of a question for Lyle and Jim. They're the experts here, but I think that it would be probably wise to have one relatively soon after that.
All right, I think we hit.
I did get a private question. As a federal contractor, where can I find in writing that vaccines are mandated and testing is not an option? That is in the president's executive order. The president submitted an executive order on the 9th that said that federal workers and contractors are mandated to be vaccinated without an option to choose regular testing. They have to receive the vaccine. if they are in any form of connection to a federal contracting job. If you want to pull up the recent executive orders of the president, it's in that same order for federal workers and federal contractors.
Wow.
And we got 2 new questions while you were talking there.
Okay.
Will social distancing be an acceptable alternative to masking as it relates to the construction industry? I feel like you've answered that, but
I'm going to say probably not. I think you're going to need to do social distance and mask. It's every available precaution. You know, if you're 500 feet away, maybe you're fine. If you're 15 feet away, you probably need to wear a mask.
Perfect. What are our options if an employee is not vaccinated and refuses to test?
Terminate.
Right. And do you think employees doing remote work will also be required to vaccinate or test weekly, or will those only be in place for on-site employees?
I would assume that they would still be required to do that. Of course, I think they would be exempt from masking requirements there because they're in their own home. But I would anticipate that they would still be required to be vaccinated, but it's going to depend on how things read. It didn't seem to make an exception for, you know, me, whether if there's an employer and every employee is, in fact, my wife works for a company and every employee is remote. But I would anticipate they still being, them still being having, goodness, they have to have the vaccine. It's the only way to put it. I got another couple questions that came in privately. Can people claim religious exemption to wearing a mask? If it is a closely held religious belief, you may be able to. I think the religious exemption is going to be stronger than the medical exemption. But there could be some pushback there, and your employer, that's going to be a question that we'll need to address when it comes out. I do think that there would still be a religious exemption, excuse me, but the strength of that religious exemption is still to be determined. And then I got another one. For federal contractors, is it only the employees who work on the contract or all employees employed? It is going to be anybody who is working on the contract or has any, I can't remember the terms. I looked at it over the weekend. It was essentially stating if you have any kind of contact with that project whatsoever, any kind of contact, even at an arm's length away to that federal contract, you are going to be required to be vaccinated. Essentially, if you are a federal contractor, all your employees are going to end up having to be vaccinated.
Great questions. And Tyler, thanks for taking them so swiftly. Good work.
Thank you.
Didn't put you on the spot or anything, did we?
That's part of the job. It's fun.
That's all right. You did a great job. Any
Thank
other
you.
questions? Just keep them flowing if people have got things they want to ask about. Do we miss
At
anybody?
the moment.
I think I got all of my private questions. There were quite a bit, but I think I don't think I missed anybody. If I did, please speak up.
Okay. Well, I suspect that we will meet again next Monday because, you know, we thought what was going to happen Saturday. It's been delayed a little bit. We'll see what happens. We'll watch closely. So we'd be glad to have another one. Are you game?
I'm game.
All right. Thank you all for joining us. Notice we've got the SHRM codes up there. I also put them in the chat box if you need them. We're available during the week. If something crazy comes up and you're worried about it, let us know. Anything else, Allison?
Nope, all good here.
I saw Brad Patrick is on there. Does he want to add anything? All right, put him on the spot. Everybody have a great day. 1 hour's time. That's not bad. And stay in touch. We'll see if we can come up with more for next week. But don't forget the 27th, put that on your calendar because I think this mental health thing is a huge, huge challenge for many, many employers, actually all of them, if they recognize it. And we've got some good stories to share with you. And if your company is doing something terrific to help people with the mental health challenge, pick up the phone and call me and let me know because we might have you share your story too. Thank you all for joining us.